I'm Betty Rich, and this is...
Hi, my name's Kaya. I'm a nurse practitioner here at Connected Health.
Can you talk a little bit about those little white things that I get that I have to have removed that you think it looks like a pimple, but it's not, it's hard, and they don't go away unless you have somebody like physically almost like tweeze them or cut them out, and how this might help with that, the glycolic.
Yeah, so that is what you're referring to is a little white comedome called milia, and it looks almost like a white head, but it's in the same family. So what I mean by that is this solution will help eat up those dead skin cells that are clogging that pore and help prevent it from recurring and also treat active ones.
Okay, so that's why I've been trying to use this more, because I had them all taken off, but now I don't want to get them back.
Yep, perfect.
And then...
Very good patient.
I know, I try. And then we go on to like serums. Let's talk about different serums.
Sure.
I have this skin soothing concentrate serum that I've been using because I had some surgery and I've had some sensitive spots. So I've been using that. A lot of times I use this natural moisture factor serum, which just feels great. There's so many serums. How do you know like which ones to use?
Yeah, very good question. It's kind of like vitamins. You know, you have a multivitamin which covers a lot of bases. I'd say that's the natural moisturizing factor. Middle one that will work for everything. And then if we notice, you're vitamin D deficient, I'm just making an analogy here, we might add a targeted treatment. So for example, this vitamin K serum works specifically on redness. Vitamin K is a clotting factor in our skin. So it's gonna help work on that redness aspect, whether it's redness from rosacea, whether it's redness from a sunburn. All those things this vitamin K will help with. So for Betty, we kind of get into the nitty gritty and we add the multivitamin, which is the natural moisturizing factor serum, plus maybe an additional something. In this case, at the moment, we're doing the vitamin K for redness, but we rotate depending on what the kind of goal is for that.
And so would you use this before? So obviously cleanse and then go to my serums. Before I would use one of these, which I would just slather all over. Do this, give it a couple of minutes, and then do those? Does that work, or does this need to be by itself?
I'd say maybe even just a few seconds. It really doesn't need to be super separate. These more targeted ones you could also use if you wanted to only in that area. So for example, like the hyaluronic acid serum, that's like a multivitamin, right? That's moisture everywhere will help. It'll help here. I keep it in the car. I've used it on the tops of my hands.
And that's the same as this moisture mist, right?
And that's
but this
the one
you can just...
Yeah, spray. Yeah, we like to send that with Betty for travel. On planes, for example, it's just easy. Especially in the winter, I keep one of those on my desk, keep one in the car.
You say you use it on your hands too?
Oh yeah, just the tops of your hands, because of all the sun exposure, when we grow up, they show quite a bit of age. So that's why I like to treat the hands with sunscreen and a good moisturizer too.
Okay, now I'm going to be obsessed with that. Doing that.